Wow. So the first session for this year, 2021. 2020 has been like a crazy roller coaster year, but I'm really, really hopeful that 2021 is going to be like amazing for all of us here. Hello, everyone. Back to a session on endometriosis awareness. So this time we are talking about endometriosis and PCOS. Yes, endometriosis and PCOS, two extremely common gynecological disorders affecting estimated 5 to 10% of women, especially teenagers and those in the childbearing age. Even though these disorders can be very, very painful and uncomfortable to cope up with, they are very difficult to be detected. An estimated 1 in 5 Indian women suffer from PCOS. That's a whopping 5 million women. Imagine, this is one of the most common hormonal endocrine disorder amongst women of reproductive age. Yet, it is so undiagnosed and people don't know about these things. PCOS is still common. Endometriosis is something which people just haven't heard of. For your information, it is much more common than a diabetes or a cancer is, but it is so underrated. So endometriosis is a disease in which tissue similar to the lining of the uterus grows in other places in the body outside the womb. So the tissue acts like your uterine tissue and does everything during your period. It'll break apart, it'll bleed at the end of the cycle, but this blood has nowhere to go. So the surrounding areas may become inflamed or swollen and might create scar tissues and lesions. The Endometriosis Society of India estimates that 25 million women, Indian women especially, okay, suffer from this condition. And yet it is rarely spoken about because of the understanding, which is like very rare, and also because of the taboo around menstruation. So to talk about this confusing topic, we have with us our own Dr. Vimmi Bindra with us today. So Dr. Vimmi, as we all know, and for the new members who don't know her, she is a consultant gynecologist and laparoscopic surgeon at Apollo Hospitals, Hyderabad. She specializes in fertility enhancing surgeries and endometriosis excision surgery. She has been working incessantly towards spreading awareness about endometriosis for both doctors and patients alike. As most of our viewers know, she is the co-founder of this particular group, Endo Crusaders, which is the brainchild of Vimmi and me, with an aim, which we created with an aim to create not just a support group for women with endometriosis, but also to create awareness about this silent disease. And I am your host, Dr. Shilpa Rao, a dentist by profession and an endometriosis advocate by passion. I'm an endo survivor and I'm on a mission to help women like me live a good quality life. Hi, Vimmi.
Hi, Shilpa. Thank you so much. So good to be back.
I swear, something big was missing when we weren't doing the sessions.
Yes, it has become a part of our routine now. Every Sunday, we just talk something about endometriosis so people understand it better.
Correct. That's absolutely right. So, Vimmi, since you have a flight to catch today, so let's make this session really fast. So let's begin the session by knowing what exactly is PCOS, and are PCOS and PCOD, they're two terms which we keep interchanging. Are they the same things?
So Shilpa, PCOS is much more commoner than endometriosis, as you have already mentioned. So 1 in 5 women are affected with PCOS and 1 in 10 women worldwide are suffering with endometriosis. PCOS stands for polycystic ovarian syndrome, where the appearance of ovaries on ultrasound is polycystic. Like there are small follicles which appear as cysts. Actually, there is no cyst in the ovary. And it is associated with some of the symptoms such as excessive hair growth, hair fall, weight gain, infertility, and a lot of other symptoms. It's basically a syndrome where other manifestations also happen. Now, PCOS, we also call it that it is a misnomer. It says polycystic ovary, but there is no cyst in the ovary. Now, these are the small follicles which ovary has it already. And every cycle, one of the follicle becomes dominant and it ovulates.
Okay.
In PCOS, under the hormonal influence, what happens is follicles may not become dominant and they appear as a small, it becomes a multifollicular ovary. So the ultrasound shows small cystic spaces. So it's just the appearance of the ultrasound, and the name was given polycystic ovary because it appears like cyst, but actual cyst is not there. Having a pathological cyst is an absolutely different diagnosis and different diagnosis altogether. Actually,
Okay.
it's a misnomer, but because for years together it has been used, so terminology has not been changed. Actually, there are some articles where they have published that the terminology should be changed because it's mostly a hormonal disorder and it misguides people also. A girl
Correct.
sees, I have a cyst in the ovary, and all of a sudden she gets worried that what will happen now. Now,
Hmm.
PCOS, typically we diagnose when 2 out of the 3 criteria is present. If a woman has irregular periods or scanty or less period, that is called as hypomenorrhea, or any of the features of hyperandrogenism, like hair fall, excessive hair growth, or acne. And the third is appearance of polycystic ovary on ultrasound. So if 2 of these criteria are present, we usually diagnose you as PCOS. Now, if you don't have PCO on ultrasound, then also you can have PCOS. So if you have hypomenorrhea, oligomenorrhea, amenorrhea, or irregular cycles along with hyperandrogenism features, you can it still be standard as PCOS.
Okay.
Second thing is PCOS and PCOD. Now, PCOD was the earlier term used. Now we are no longer using it. That is polycystic ovarian disease. If we basically look at the definition of disease, it is a disorder of structure or function in a human, animal, or plant, one that produces specific symptoms or that affects a specific location. That's the
Hmm.
reason this terminology is no longer used, because PCOS affects the whole body. It does not affect only the ovaries. Now,
Okay.
syndrome, basically, medically speaking, it is a set of medical signs and symptoms which are correlated with each other and often associated with a particular disease or disorder. So, this PCOS fits into this definition. That's the reason we now use PCOS. And yes, it does confuses people why it is called PCOD, PCOS. Basically, PCOS is the current medical terminology which we use. That stands for polycystic ovarian syndrome.
Okay. I think that completely clarifies our doubt about PCOS and PCOD. So, Vimi, what are the common symptoms that are associated with PCOS?
So most common symptoms are irregular periods. In irregular periods, a girl may have delayed cycles or scanty flow or absence of periods for 3 to 4 months altogether. Second is weight gain. They have acne. They have excessive hair growth on upper lips, chin, other parts of the body in a male pattern hair growth. They have male pattern baldness, frontal baldness, and hair loss. Also, there are 2 categories of PCOS. One is obese and one is lean PCOS. The same symptoms may be present in a woman who does not have weight gain, or she falls into the or has a normal BMI. She falls into the category of lean PCOS. But 80% or the majority of population is obese PCOS.
Okay.
And apart from this, they also have a lot of mood swings, changes in the body due to increased insulin resistance. Like they often develop blackening of this area on the neck, that is called as acanthosis, blackening of these areas. So this happens because of increased insulin resistance, depression, mood swings. Definitely, ultimately, it also leads to a lot of social issues when they develop these symptoms because their appearance changes altogether.
Hmm.
They don't feel good about it.
Absolutely. I mean, I'm sure because, when it comes to young girls going through symptoms, even college going girls having the symptoms like excessive hair growth and all, socially it is very difficult because people don't understand that they are going through issues,
Mm.
and it's easier for people to make fun of somebody else just by the appearance. So,
Yes.
so I feel it takes a hit mentally also and emotionally also, not just physically.
A lot
Yeah.
of emotional and psychological symptoms also.
Correct. So, Vimi, how common is PCOS in young girls?
Yeah, as you said, they make fun of and all that. I wanted to tell that many of the adolescent girls are having PCOS.
Hmm.
Uh, Basically, because of the lifestyle, They are having mostly sedentary habits, and food habits are not good. So many young girls are developing this PCOS again with increased hair growth, weight gain, and irregular cycles. Now, a lot of bully and lot of peer pressure happens in the school when these girls face this problem. So mothers should be made aware of that this is not normal and they should be taken care of. If we just put them into a little lifestyle changes, they can get rid of all the symptoms. It's not difficult to do, but the thing is that motivation and that push has to come, and there has to be awareness that yes, it has to be looked into it at an early age.
That's correct. That's absolutely correct. And also, as you have just said, that there is insulin resistance in PCOS, right?
Mhm.
So you know, how frequent is it for girls with PCOS to develop diabetes? Are they prone to developing diabetes?
Yes. So PCOS basically, what we tell you is a lifelong disorder. It is like diabetes and hypertension. It is there for life. It has its own long-term sequelae if it is not managed properly. So many of the women have a conception that if you have conceived, PCOS is done. So it is
Correct.
not like that. If you have PCOS, you have to follow the lifestyle management for life, because PCOS can lead to diabetes mellitus at a very early age. It can lead to heart disease. It can lead to metabolic syndrome, altered lipid profile, and if you don't get periods on time, or if you don't have at least 4 to 5 periods a year, endometrial hyperplasia and endometrial cancer chances are also there. So
Oh,
diabetes is one of the very common disorders which these women can develop. Especially pregnant women are also to diabetes, like pregnancy with PCOS, because insulin resistance is high and their carbohydrates are not metabolized properly. That's why we stress so much on diet and exercise in PCOS patients. So they are prone to diabetes if they don't manage it well. Suppose a girl has to develop diabetes at 50 years of age, she might develop it at 35 years of age.
okay.
So their insulin resistance plays a very vital role. It has to be controlled at an early age, and it's not just the pregnancy or delivering a baby. It's a lifelong management, and it should be looked into.
That's absolutely true. So for people listening to this, don't treat PCOS as a one-time treatment. You know, you have to go for a long-term therapy for PCOS, a long-term management of PCOS. So Vimi, also I wanted to check with you. Lifestyle, as you just mentioned, plays a major role in PCOS, right? So how does lifestyle, a change in lifestyle, modify PCOS?
So lifestyle basically comprises of diet and exercise. Now, as I said, insulin resistance is increased in these patients, and they are obese as well. So
Correct.
weight loss helps reducing the insulin resistance, and insulin resistance is involved in all the hormonal imbalances. So if the insulin resistance is corrected, definitely all her problems will get corrected. This also helps in reducing the androgens, the male hormones in the body, ultimately improving your acne, your hair growth, your weight loss. So diet and exercise. Diet, we usually recommend a gluten-free diet, less of carb-rich food, but that does not mean you just switch over to complete keto diet and all that. We don't recommend that. It has to be a balanced diet again. And exercise, moderate to severe activity for fit women, those who don't have other medical comorbidities. They should practice and exercise at least 30 to 40 minutes 5 days a week. That's the minimum I am recommending, but consider most of the women, what happens is when we tell them diet and exercise they do for a couple of weeks or maybe 1 2 months and then say we are not losing the weight. So it is not about immediately losing the weight. It is about maintaining it and keeping your metabolism in check. If you keep doing it, definitely you will reach a threshold where you will start losing the weight. So you have to be consistent with your efforts and don't get demotivated if you don't immediately lose weight. If you keep doing exercises, it will keep your present metabolism in check. At least the disease will not progress further. So it takes time, it takes a while. Don't get disappointed. Most of the PCOS patients, this is what happens, they do exercise for 1 or 2 months, but after that they absolutely, if they don't lose any weight, they just stop everything, and that's not correct. They should continue it. And I have seen those who are continuing after 5 to 6 months, once their threshold has reached, they start losing weight rapidly, and that gives very good results.
That's true, because it is very disheartening for a person who is already a little obese. First of all, it takes a lot of push for you to start exercising as much, because it's not easy. Physically, it's not easy to do exercises as much with so much going on in your body. And again, doing so much of exercise is still not losing weight. But saying that, as you correctly pointed out, Vimi, you have to reach a certain threshold, certain place. Once you reach that point, only then your weight will start dipping. And
Absolutely.
the diet obviously will play a major role. So try having an anti-inflammatory diet, which is like, and take a advice of a nutritionist. If you think you're not able to manage your diet properly, take help of a clinical nutritionist who will be able to give you a proper chart on what to eat and
Yeah,
how to
it
eat.
has to be a customized chart,
Correct.
because everybody is different, their BMI is different, their calorie requirements are different. So usually
Absolutely.
we recommend a gluten-free diet for PCOS and an anti-inflammatory diet for endometriosis.
Endometriosis. Yes, that's right. So, Vimi, what are the modalities of treatment for PCOS?
Shilpa, PCOS treatment depends on the symptoms and age and requirement for the patient. Suppose lifestyle is the first part of the treatment that we cannot omit in any age group, diet and exercise. Then comes suppose there is an adolescent girl who is not getting regular periods and has acne and all those things. So we regularize their cycles and make sure that she gets at least 5 to 6 periods a year. And we work on her weight and exercises and diet. Now, a woman who is married and in the middle age looking for pregnancy, and if she has an ovulatory cycle, she might need help with the ovulation induction.
Correct.
But for obese women who are looking for pregnancy, we usually recommend a weight loss. If 5 to 10% of weight loss happens, that gives very good results with the fertility treatment also. A woman who has already completed her family, again, we look at the number of periods she is getting in a year, and we work on her hair growth, acne. It all depends on her requirement, what she is looking for. So treatment is symptom based and age based.
Okay. All right. I think we have covered quite a bit of what PCOS is, how does lifestyle help in PCOS, and what kind of treatments are available for PCOS. So now let's move to our next topic, which is endometriosis, which is something most of the people don't know about. So, Vimi, just tell us a little about what exactly is endometriosis and how is it similar? Is it similar to PCOS?
Shilpa, endometriosis and PCOS are two different entities. So they are absolutely different entities, but a same woman can have both. Now, endometriosis is basically, I would say it's a genetic disorder, or theory of mulleriasis explains it, that how it develops and how it grows. In this, we have an endometrium, we have a uterus, we have an endometrial lining, which sheds every month. All of us know that. Now, similar tissue gets implanted outside the body. It's not the endometrial tissue that I would like to clarify, because for years there is a Samson theory which is going on, and people believe that because of the reflux menstruation they develop endometriosis, and that does not explain this disease. So this is basically similar tissue implanted outside the uterus. Most common site is ovary, but it can be present anywhere in the body, especially in the pelvic peritoneum, over the ureters, tubes, ovaries, over the bowel. These are the common locations. Other than a spleen, it can affect any part of the body. Some women may not have pelvic endometriosis, but it can be present once they have a cesarean or so. This is called as abdominal wall endometriosis or scar endometriosis. Now, this endometriosis, endometriotic tissue, releases its own hormones, and it keeps growing and causes a lot of fibrosis, inflammation, and gets stuck to other organs and structures, creates adhesions. So this is absolutely different pathophysiology from PCOS. This is not same as PCOS. Now, endometriosis usually it can be a silent disease. We detect only during when a woman comes for evaluation for fertility. But in 50 to 60% of the patients, it causes painful periods. Now, that pain is extreme, like killer cramps. They can't do their routine activities. If somebody has pain during periods and they're mild cramps, by taking mild rest, mild analgesic, it subsides. It can be a normal thing. But any pain which interferes with your routine and does not let you do any regular work, or you miss your school, or you miss your college, miss your work, then that absolutely is not normal. It can also cause painful defecation, painful urination, painful intercourse. It all depends on the location and size of the endometriotic lesions, which are inflamed and they cause the pain. So pain is most common symptom which with which women come to us. Second is infertility, and then comes other symptoms. They have a lot of. They also have mood swings, depression, bloating. This also is confused with a lot other disorders like inflammatory bowel syndrome and all. So a lot of misdiagnosis happens in endometriosis. So this is not same as PCOS, but same women can have PCOS and endometriosis both. There we need to differentiate a bit and then treat her accordingly. PCOS is a hormonal disorder. Endometriosis is influenced by hormones, but due to implantation of endometrium-like tissue. Now, treatment for PCOS is basically medical. Treatment for endometriosis basically is surgical. So they differ a lot, but sometimes they present with both together.
That makes sense. So, what I have understood is endometriosis is an inflammatory disorder which is influenced by hormones, and
Correct.
PCOS is absolutely a hormonal disorder. So there is a difference. A lot of times, even the gynacs, I think, interchange these things. And I mean, for example, I was being given treatment for PCOS, though I never had PCOS. I had
I would like to mention many girls complain of pain, but they don't have any evidence of endometriosis on scans.
on scans.
But
Correct.
most of the scan centers and diagnostic centers, they have started writing polycystic appearance of ovaries.
Correct.
Now, polycystic appearance of ovaries has a set criteria to stamp it as polycystic ovary. There should be a minimum of 10 to 12 follicles in each ovary. Each follicle size should be 1 to 2 millimeter. The ovarian volume should be more than 10 cubic millimeter. Nobody mentions that.
Correct.
And they just write 6-7 follicles they will see, and they write PCO. Now,
Correct.
what happens is this girl has pain. She goes to a gynecologist. She says you have PCO. And they start treating them with glycomet and oral contraceptive pills. But she might be having endometriosis because she has pain. And endometriosis may be missed when a girl has early lesions.
Correct.
So these things are very, very important, where patients should be aware of whether the diagnostic centers, those who are doing the scans, they are following that PCOS criteria or not.
Correct.
The PCO, bilateral PCO, like 90% of the reports are writing bilateral PCO.
Absolutely. Absolutely. That's true.
It's
So that's what.
psychologically taxing, not only for that girl, for the mothers, especially.
True.
They keep running to us. Doctor, my daughter has a cyst.
Correct. Correct.
So
That's what I'm saying. It's more about a particular criteria which has to be met, and that's something which has to be, it has to be a combination of good diagnostic, a good radiologist and a good gynecologist coming together. That's how a diagnosis has to be made in cases with PCOS or endometriosis. So, Vimi, endometriosis is one complex disorder. So, what does a patient with endometriosis go through? And why is there so much delay in diagnosis? An average patient takes about 12 years to get diagnosed, approximately. So, why does it take so much time to get diagnosed?
it's a very complex disorder, as you said. Agree with you, and it's basically an iceberg phenomena. What we see, it is much more than that. Similarly, surgically speaking, the lesions what we see are the superficial. They have in depth, so that's why we recommend that excision should be done. Now, these patients, as I said, the common symptoms: painful periods, infertility, painful urination, defecation, depression, bloating, fatigue. Fatigue is one of the very common symptoms, which is taken for granted for women because she does work outside and in the household, so she is entitled to get fatigue. Okay, so if she says I feel tired all day, but nobody believes her. Second is dismissing patient symptoms is one of the reasons for delay in diagnosis. Most of the times, a girl is told that pain during period is normal. I had it, your mother had it, your grandmother had it, so it's absolutely fine. Once you get married, have your children, it will be fine. So that is one thing they report to the doctor late. Second is early endometriotic lesions may not be picked up on scans, or if you don't have expert eyes to look for endometriosis, it can be missed. That is a very important reason for delay in diagnosis. Third, most common and important reason is dismissal of symptoms by the gynecologist also. So general gynecologists also dismiss symptoms of pain during periods when they don't find any associated cyst or major abnormality on ultrasounds. So what happens is these girls keep roaming around and they go to 6-7 gynecologists. By that time, in those 6-7 years, their disease becomes advanced. And if nothing is there, nothing on ultrasound, and she says pain, the doctors keep putting her on oral contraceptives or some kind of progesterones. So for the time being, her symptoms may come down, but disease keeps on progressing. And that is how the delay happens, and that is how her stage 1 disease may become a stage 4 disease. So a lot of running around and lack of awareness among patients as well as doctors. So if a girl has painful periods, we should believe that she has pain. She is not faking it up. And that leads to a lot of psychological and social issues associated with it. One is dismissal of symptoms. She believes that she can't handle it. Second is, if she has painful intercourse, there is a marital disharmony. Getting pregnant is difficult if they have painful intercourse, and sometimes silent endometriosis damages their ovary to such an extent that getting eggs is very difficult even with IVF, or the egg quality is so bad. So if we address this disease at an early stage, we can prevent this damage to ovaries and other structures. So if we can have some cutoff that yes, we should not delay this diagnosis beyond this, or there should be certain guidelines or certain criteria where we can follow when patients present with painful periods, will be good.
Exactly. When it is said that painful periods is normal, it is the biggest lie that one can ever say. How can somebody justify which pain is normal and which pain is not normal? Somebody going through severe pain is obviously not normal. You know, just because your mom had some pain or your grandmom had some pain doesn't mean that your pain is not there, or you're trying to fake it. Okay, so uh, people have to accept that period pains are not normal. Extreme period pains are not normal. Slight cramping is something which is acceptable, but anything that is interfering with your routine day to day life is a big red flag. You have to see your doctor. So now we know what to see for. The next step is, okay, fine, I have got diagnosed with endometriosis. Now what? So, what is the treatment for endometriosis?
Shilpa, basically endometriosis is a surgical treatment. Wherever the disease is, we remove it laparoscopically. That is called as laparoscopic excision surgery.
Okay.
As I said, the lesions are deep. What we see, the lesion may be superficial, but it may be deep penetrating into the structures. So we have to scoop it out actually. We have to cut it out and remove all the lesions. There is also a popular treatment called as ablation. So that should not be done. Ablation just burns the superficial surface of endometriosis, but it does not remove the disease. And it is a very common cause for recurrence of the disease. So if somebody is looking for endometriosis surgery, they should talk to their doctor regarding excision surgery, where we excise all the lesions wherever it is. Yes, the lesions can be on the ureters, can be on the bowel. So we usually involve urosurgeon and a colorectal surgeon if required. So you should look for an endometriosis specialist, those who have a complete team and they can address the problem of endometriotic lesions wherever it is. So if you leave the disease, again, it will come back and you will have a poor quality of life post-surgery also.
Correct. Correct. That's true. So how common is it for a person to have both endometriosis and PCOS together?
Shilpa, it's very difficult for me to give you exact percentages, but of late we are seeing a lot of women who have combined endometriosis and PCOS. Now, most of these are a little, their BMI is little on the higher side. Now, symptom confusion happens because the endometriosis causes ovarian destruction, and we do check AMH levels in the women, right? So in PCOS, AMH is high. In endometriosis, AMH is very low. So
Okay.
you may get a false reflection of those values.
Okay.
Okay. If she has combined PCOS and endometriosis and PCOS with the hormone levels, also we can know that how severe it is and her symptoms. Now, when we discuss about fertility in these women, we have to be very careful because in PCOS AMH is very high and in endometriosis AMH is very low. And if I get an AMH of a optimal value, it may be suggesting us that her AMH is very, very low.
Correct. Correct.
Right? Because we see AMH of 6, 7, 11 also in PCOS patient and sometimes even higher, and in endometriosis patient it can be as low as 0.00 something. And somewhere if I see AMH of 2 or 1.5, so I have to see her antral follicle count and how many eggs are there. So sometimes it might affect the one ovary as PCOS and other ovary as endometriosis. Very common. And in these cases, we have to assess her fertility beforehand because sometimes after excision surgery, AMH may drop further.
Okay. Yeah.
And as we know that in PCOS, treating fertility is very easy because you just have to induce ovulation and it really works well. But in endometriosis, what happens is egg quality is also poor. Number of eggs are also less. Now, if we don't assess her antral follicle count and other things beforehand, and after surgery her AMH is almost nil, in that case, getting her eggs even for IVF will be very difficult.
Okay.
So these cases we have to handle very carefully and counsel the patient properly, especially in terms of fertility I'm talking. The rest of the management will be same, lifestyle management will be there. And if she has, these women may have painful periods along with hair growth, acne, and all the features of PCOS. So combined features will be there, and a good sonologist can help us defining the extent of the disease. And endometriosis has to be excised. Now, PCOS, many women come to us and they say, "Doctor, do the drilling and I will be cured of the PCOS." Now, that's another myth which people have, that doing a drilling will remove your PCOS. It's not like that. Many young girls have come to us already. PCOS drilling is done at 18 years of age, 20 years of age. So PCOS drilling is not the treatment for PCOS. We do drilling only if her ovaries are resistant. Like if we have given ovulation induction and none of the drugs are working. In those cases, or if LH levels are very high, then only we do the drilling. So even if I do laparoscopy for endometriosis, if she does not need drilling, we will not do unnecessarily because that will destroy her ovarian reserve and ovarian cortex.
Correct.
So this use of cautery on the ovaries has to be very judicious and should be discussed in detail before you go for these kind of procedures.
That's quite informative, actually, because my next question was about that only. That how can you tell the difference between PCOS and endometriosis? People are so confused. Even the doctors, when it comes to PCOS and endometriosis, there is so much of confusion going on. But I think you covered most of it about the difference. Is there something else that you would want to add, Vinny?
No, see, on ultrasound, there is set defined criteria for PCO that should be followed, and endometriosis, wherever the lesions are, if somebody can map those lesions, it's very good for management and counseling. Otherwise, clinically, also we can make out the nodules, but PCO, I cannot tell how many follicles and antral follicle count and all that by clinical examination. Endometriosis, yes, if she has a bowel nodule, if she has a uterosacral nodule or a rectovaginal nodule, that on clinical examination I can palpate. And to some extent, I can tell them that yes, you have endometriotic lesions there.
Hmm.
And if the cyst size are big, then definitely anybody can pick it up.
Correct.
Now, in terms of clinical features, PCOS and endometriosis patient will have both. She will have weight gain, she will have hair growth, acne, hair fall, along with painful periods or infertility issues.
Hmm.
So if it is a silent endometriosis, she may not have pain, but
Correct.
on ultrasound, she will show up the disease. And if it
Hmm.
is not silent, she will have painful periods also,
Okay.
but irregular cycles.
Hmm.
So it's a
But
wide range of presentation, Shilpa. So very difficult for me to define what exactly she will present with.
correct.
But yes, she might have irregular periods, but painful. So that is
Correct.
one of the indicator that where we should look for why she has so much of pain. So
Hmm.
endometriosis will be picked up along with PCO.
So the main thing is, Vimi, what I feel is the gynacs also have to open their eyes to endometriosis. Your mind, I see what your mind wants to see. It's as simple as that. If they don't want to see an endometriosis, if endometriosis is just not there in their mind, they would never, know that there was something called as endometriosis, which might be troubling that girl,
Hmm.
you know. And when it comes to endometriosis or PCOS, it is not only a physical problem which is there. There is a lot of mental and emotional distraught which a person goes through, not because of the pain. The pain per se is any which way is one of the reasons, but the second biggest reason what I've seen in people is the anxiety that they might never be able to experience motherhood, because of PCOS and endometriosis. So, is infertility very common in both PCOS and endometriosis? And what is the scope for a woman to have a child?
So infertility is one of the symptoms, or it's a spectrum of the disease, but that's a myth that they don't conceive. Many women, especially PCOS women, if they especially stick to their lifestyle and diet, they conceive spontaneously also. They don't even need ovulation induction if they reduce their 10% of the weight. They
Hmm.
do pretty well. And if they don't ovulate, ovulation induction helps them. And the last resort is IVF. So
Okay.
there is nothing to get panic and that PCOS patient cannot conceive. Many doctors have told them that you can never conceive. So patient do come to us with a lot of tension that my previous doctor has told me this. So that's absolutely not correct. And they can conceive. They can conceive even without any treatment. Now, endometriosis patient, most of the time it depends on the stage of the disease. Also, it depends on the egg quality and ovarian reserve. A good surgery actually is a fertility enhancing surgery. If we do a good excision, completely excise all the disease, and they have good ovarian reserve, they do conceive spontaneously. Otherwise, with minimal ovulation induction and all, they do conceive. If they have very low ovarian reserve and quality of egg is not good, in that case, they might have to go for donor egg IVF. This is for endometriosis patient I'm talking. And there are some patients, those who have stage 1 or stage 2 disease, where their ovarian cyst size is not very big, but they have very low ovarian reserve. In these cases, what we do is we tell the patient to preserve their eggs if she is not looking for pregnancy or she doesn't have a partner immediately. So she can keep her eggs in the IVF lab by cryopreservation technique. And then we do the surgery so that she does not lose the reserve further.
Correct.
And she can use those eggs when she has a partner and embryo transfer can be done. Those who are married and will be looking for pregnancy, and we anticipate that after the surgery she might lose her ovarian reserve further, and ovarian cysts are not very big, I'd send them for cryopreservation of embryos, then do the
Hmm.
surgery, then transfer the embryos, and chances are pretty good. It's all depends on what options we can provide them. She
Correct.
is not aware what is cryopreservation, that she can keep her eggs even if she is young. So all these options, if it's like a cafeteria approach. If we offer them, then they will have they can choose and pick it up.
Absolutely, absolutely. The patient doesn't know. The doctor has to inform the patient about the choices which are available, of the options which are available for the patient, and
I had patients last month from Bangladesh and some other countries, so they wanted to come immediately for surgery and looking for pregnancy also. So in that case, I told them, you check your ovarian reserve and all those things, because your ovarian cysts are not very big, immediately doing the surgery. And if your ovarian reserve falls, you will end up in a problem. Then I
correct.
recommended them in a local IVF center, you preserve your embryos and then come for the surgery. I can do surgery. Surgery is not a big, but I have to look at that patient in her long-term obstetric career, in her long-term quality of life.
Correct, correct. So that's what for young girls who have endometriosis, the doctors per se advise, that first get married, have a child, and then think about going for a surgery. Which is not something I think is right, because you can give them options about freezing their eggs and do a surgery. At least that girl will live a better quality of life. You can't just hold.
Similarly, one couple came, and they're not trying for pregnancy immediately, but she has severe painful periods. Very painful, like she can't do anything. So in her family or in one of the relatives, they have a doctor. So they said, you try for pregnancy first. They're not even looking for pregnancy. Nowhere comes her quality of life.
Exactly.
So why we are overlooking that?
So because that's what I'm saying, because the quality of life for a woman is something which is not a priority. So we, by doing these sessions, we want to emphasize that quality of life is supposed to be good for both males and females together. So this is for all the men who are watching this program or who would watch this. Any woman in your family who is going through issues, please, please seek help, and look for options available which will help her live a better life. It will help her, and in turn it's going to help everyone in the family. A one happy woman is going to make a family happy. So that's how it is. And I think we have covered almost everything that comes to PCOS and endometriosis, and I think it was a very, very helpful session. So I'm ending the session with a note that if left untreated, PCOS and endometriosis can become serious problems. All the symptoms you experience can lead to other health issues and other health risks if you don't seek a doctor's treatment and go for a proper consultation. But the good news is, with a proper diagnosis, proper treatment, and lifestyle changes, the outlook of PCOS and endometriosis is positive. So we leave you all with a positive note. Have a lovely Sunday. And thanks, Vimi. Thanks for the lovely information that you gave us today.
Thank you so much.
Thanks to everyone who actually joined us on a Sunday morning. I didn't expect people to join in on a Sunday morning, but it was like indeed a lovely thing. Thank you, everyone. And thanks to all of you who are going to watch us later as a recording. And looking forward to another session on endometriosis awareness. Thank you and have a lovely Sunday. Bye-bye.
Thank you all. Thank you, Shilpa.
Bye.